It's back to school in America, with millions of children wrapping up their summer vacations and ready to learn in a nurturing environment. But public health experts are questioning that safety by warning that vaccination rates for kindergartners are dropping.
We've fallen below the magical number of 95%, which is a number and the absolute minimum needed for herd immunity. That is the amount of people we need to vaccinate to protect the people who can't have an immune response.
U.S. children entering kindergarten are required to get vaccinated for polio, whooping cough, chickenpox, and the measles. But Chin Hong says more parents are getting exemptions for their children for medical reasons or personal or religious beliefs. Chin Hong finds that very concerning, especially for the measles, which resulted in the death of 2 unvaccinated school-age children and sickened more than 700 people in West Texas earlier this year.
You can go into the room and be unvaccinated or undervaccinated and get that measles, even though the person has exited the room 2 hours ago. I think about measles as being, one of the more key vaccines. And of course, the second is pertussis or whooping cough. And we're seeing outbreaks of measles and whooping cough because they are, very easy to transmit.
Chin Hong and numerous infectious disease experts say one of the reasons behind more requests for exemptions is politics. U.S. Health Secretary Robert F. Kennedy Jr. recently removed COVID-19 vaccinations from the CDC's list of recommended immunizations for healthy kids and pregnant women. He also recently cut $500 million in funding for mRNA vaccines.
We've watched him take it away from younger children, where we know early on they do need the vaccine so they don't encounter the virus for the first time with no protection. But in fact, we don't have a clue what tomorrow he is going to say.
And the truth is that there are other countries around the world, including China, as well as Europe and Asia in general, that are not throwing away their investment into mRNA research and mRNA vaccine development. In fact, they're doubling down. And if we don't reverse these decisions soon, then we'll be watching other countries achieve innovation in this space, have life-saving medicines that we simply don't have access to.
Chin Hong says the U.S. decision to halt funding for organizations like UNICEF and the Global Alliance for Vaccines and Immunization, and also withdrawing from the WHO, hurts its own population too.
If you don't protect kids around the world, you make each individual country much more vulnerable because borders are very porous to infectious diseases.
Chin Hong also points out that for older children, flu vaccine rates have been steadily dropping. One reason the U.S. recently experienced the worst flu season in more than 15 years. Mark New, CGTN, Mountain View, California.